This is an update about HIV and some useful discussion about the current and future treatment of HIV and where we are about the cure of HIV. HIV is not a disease as it was in earlier days. HIV is now considered as a treatable long-term medical condition. With treatment, patient can survive long and can live with good quality of life. Treatment can be simple as one pill a day. Early diagnosis can save life and can prevent the person from unknowingly passing the infection to others. With better understanding about this infection and with availability of more and more drugs with better formulation, HIV can be treated and the virus can be kept under control. HIV affects body's immune system or defense system by attacking a particular type of white blood cells called CD4 cells. For a healthy individual whose immune system or body's defense system is normal, CD4 count can vary from 500 to 1500 cells per drop of blood. Immediately after infection, HIV goes high in the blood and at the same time CD4 number drops. But after a few weeks, the amount of HIV in blood starts dropping and CD4 starts rising and remain high for a long time. During this period, patients may not have any symptoms. But after several years, this balance is lost, the virus goes high again and CD4 starts dropping. As CD4 count drops, the risk of developing AIDS increases, and when the CD4 count drops below 200, the risk of AIDS is high. Hence, diagnosing early and starting treatment early can remove the risk of developing AIDS almost completely. Treatment of HIV involves using anti-HIV drugs. These are called antiretroviral drugs. These drugs target replicating virus or the multiplying virus. Different drugs are used in combination, but they can be available in single tablet form. Therapy is lifelong. As it stands at the moment, treatment is for an indefinite period as there is no definite cure available. With better formulation, patients can take the tablet according to their lifestyle choice. Some can be taken in the night or others at any time of the day, and the restriction of taking it with food or without food is becoming less and less important. And that is also giving individuals living with HIV of more freedom to work and lead normal lives. While the picture is bright in developed countries, it may not be so in other parts of the world, where the drugs are not freely available or the treatment options or facilities are not so readily available. How do the drugs work? The virus attaches to the CD4 receptor with the help of co-receptor. Then it fuses with the cell wall and enters the cell. With the help of their own enzymes, the virus multiplies using the cell machinery, gets matured, and then come out and infect other CD4 cells. Most of the drugs work mostly by inhibiting the viral enzymes, and only one type inhibits the viral co-receptor. The drugs are used in combination and they are highly active, and that's why they are called highly active antiretroviral therapy, or in short, HAART, HAART. There are other drugs in the process of development which do not work against the viral enzymes. There are several proteins within the cell which HIV depend for their survival. These are called HIV dependency factors. Very few of them are known or identified, like CCR5, CXCR4. But many are new, and research is in progress to know exactly what their function or relationship could be with the virus. Drugs blocking these factors have the potential advantage that they would not be affected even when the virus develops resistance to the available drugs working against the viral enzymes. Currently, the agents which we use, most of them inhibit the viral enzymes except the CCR5, which is a host-derived factor. How about cure? The biggest difficulty in the cure of HIV is the way the virus lives within the human body. The virus remains hidden in different parts of the body, and that poses a great challenge in the cure from HIV infection. The group of CD4 cells which are already infected can remain hidden in different parts of the body called viral reservoirs. Here, the CD4 cells can sleep along with the virus for a long time and can be awakened and released into the blood and become active. We can call these areas as sanctuary sites for the virus. Examples can be the brain, prostate, the lymphatic system, supplying different organs, particularly the intestines. These reservoirs are not only a good site for the virus to hide, these reservoirs are safe because either the drugs cannot reach them or not reach in enough concentration to be effective, which can then encourage the virus to develop resistance to the drugs and remain at those areas for a long time and continue to sleep, waiting to infect the rest of the CD4 cells in the body. What can we do about them? Can the viral reservoirs be cleared? Several options have been considered and tried, and lot of research are in progress. One option could be that the virus which remains in the CD4 cells within the reservoirs can be flushed out by creating or inducing an artificial inflammation within the reservoirs. When they are flushed, they can be killed with the available antiviral drugs in the blood. The other option would be to trap the virus down inside the reservoirs. With the help of very small particles called nanomagnetic particles, the virus trapped inside the reservoir can be targeted with the drugs and kill them within the reservoir. These are still in the very early research stages, and progress is happening, but not at a very fast rate. HIV needs co-receptors, CCR5 or CXCR4 or both. At early stage of infection, most of the virus needs CCR5 to attach to the CD4 cells. As the disease progresses, the virus can change its preference from CCR5 to CXCR4, or it can prefer both CCR5 and CXCR4. Less than 1% of people of white ethnic origin have been found to have a defect in their CCR5. When this defect is present, the virus cannot use the CCR5 and therefore cannot attach to the CD4 cells, and the virus dies within the blood. This concept has been tried in the form of bone marrow transplant with CCR5 defect from an HIV negative person has been tried in HIV patients. Only one HIV patient who had acute leukemia survived and became HIV negative and remained HIV negative so far. But it is not a treatment option for all other patients, as it can be very toxic. Recently, scientists have been able to prepare genes of CCR5 with a similar defect which inhibits HIV from attaching to CD4 cells. These have been used as gene therapy in small number of patients, and the results appear to be very encouraging. The patients who responded to gene therapy had viral load undetectable in their plasma without any antiviral agents. This may not be considered as a viral cure, but can be considered as a functional cure and is highly promising as a future line of effective treatment. The cure for HIV is yet to come, but a lot of research is in progress, so great hopes are there. It is very important that HIV is diagnosed at early stages so that treatment can be started soon. This will not only improve the survival but will also reduce the risk of transmission. However, condom use is essential, as prevention is better than cure, and condom use is still a simple, safe and effective option. HIV has caused havoc in the whole world over the last few decades. But the time has now changed. The virus has been attacked, and the virus is frightened. The virus is hiding deep and deep into the body. But there will not be any gate away for the virus. The virus will be hunted, and it has to leave the human race one day. It will be very difficult, but the challenge has been accepted, and I firmly believe we shall overcome, and we shall definitely overcome one day.